Knock, knock, knock. Hi, I'm Melissa. I'll be your student nurse today. I'll wash my hands. So that I take privacy. Can you tell me your name and date of birth? And she says Mary Smith, 5/18/1963. That matches her wristband and the MAR. So I hear you're having some nausea today. She says yes. So I checked your MAR, and you have ondansetron, IV push every 4 hours as needed for nausea. So that's an antiemetic that could help with help kind of subdue that nausea and so you don't vomit. Do you have any allergies? And she says she's allergic to morphine, which we're not giving that, so that's fine. I also looked in your MAR and you have a PICC line dressing change due as well, but we'll give you the Zofran through your PICC line first, and then we'll change your dressing. Alright, so I'm going to get my med ready here. So I did my math, and she has 4 milligrams of the Zofran due. And the Zofran is 5 milligrams per 2 milliliters. So that's equal, so 4 milligrams is equal to 1.6 milliliters. And I looked at my expiration date, and it's not expired. And my flushes are not expired either, so that's good. And I checked my Buddy book, and it's the Zofran's compatible with normal saline. And the rate, and it does not need to be diluted. And the rate for the Zofran is 2 to 5 minutes. Okay, so I am going to get my Zofran here. I'm going to waste it to 2 to 5 or 1.6 milliliters. Okay. Cap back on. And I will check my 5 rates here. So Mary Smith, 5/18/1963. She has ondansetron due for nausea, 4 milligrams equal to 1.6 milliliters. So I'll show you here. There's a few bubbles in there that I would get out. Okay. So she has that due IV push at a rate of 2 to 5 minutes every 4 hours as needed. So she had it last night, so she's fine to have it due. Mary Smith, 5/18/1963. She has ondansetron due for nausea, 4 milligrams equal to 1.6 milliliters. IV push at a rate of 2 to 5 minutes through her PICC line every 4 hours as needed. So she had it last night, so that's fine. Mary Smith, 5/18/1963, has ondansetron due for nausea, 4 milligrams equal to 1.6 milliliters. IV push over 2 to 5 minutes in her PICC line every 4 hours as needed. So that she had it last night, so that's fine. And then Mary Smith, 5/18/1963, ondansetron due, 4 milligrams equal to 1.6 milliliters. IV push over 2 to 5 minutes in her PICC line every 4 hours as needed. Alright, so then I'm just gonna, I'll prime my flushes right away. Okay, so now I'm gonna wash my hands. Gloves on here. And I'm just gonna assess the site of the PICC line. There's no tenderness, swelling, or redness, so it looks okay. If there was a heparin flush per my facility protocol, I would withdraw the heparin before I started giving my med. And then she does still need it per, she's getting long-term antibiotic therapy, so she does still require the PICC line. Alright, so I'm gonna clean my cap here with alcohol as my facility requires. Clean my cap for 15 to 30 seconds or however long the facility requires. And I'm going to flush the PICC line, unclamp it, flush my PICC line. Throw that away. And then I would take my med and then unclamp it, and I would give my med over 5 minutes. Okay, so it's been 5 minutes, and then I would clamp it. Clean in the cap again, 15 to 30 seconds. And then I would give my flush again at the same rate. I'll give 5 milliliters at the same rate. Well, I'll unclamp it. Give it at the same rate as my med, so I'll give 5 milliliters. Okay, so it's, alright, so that was 5 minutes, and then for the last 5 milliliters, I'll do a pulse technique to really flush the line. Okay, and then I'll clamp. And then I'll just clean the site again. And then I'll put a cap on if my facility requires. Otherwise I'll just, and when I'm giving the med, I'll make sure to assess for any adverse reactions that the patient may have. And she looks okay. She's not, she looks comfortable. So I'll just give her Collate, make sure she's comfortable. Take off my gloves, wash my hands. And then I'll document time, date, what I gave, how much,